Welcome to the ILAC pre-departure module of Health and Safety Information. We will cover the topics of bringing prescription medications abroad and a personal first aid kit, CISI insurance coverage, what if I get sick, tips for staying healthy while abroad, and the ILAC on-call emergency number. If you are bringing prescription medications with you to the Dominican Republic, make sure you're bringing enough for your entire time abroad. Keep the prescriptions in their original containers with your name on them and always pack them in your carry-on luggage. If you have a chronic health condition, make sure others in your group are aware of the condition and how to support you should there be an emergency. If you have electronic equipment to monitor or support a condition, bring plenty of backup batteries just in case. You should bring a basic first aid kit of personal items with you to the DR. Extra items can be purchased at a pharmacy in the DR if needed, but it's good to have a basic supply with you when you arrive. These items include pain reliever or fever reducer like Advil or Tylenol, antacids like Tums or Mylanta, Pepto-Bismol tablets or Imodium, anti-itch cream, antibiotic ointment like Neosporin, Band-Aids, an antihistamine, Dramamine, maybe some throat drops, cough drops, or emergency or some sort of vitamin C supplement. You should bring a reusable water bottle to the Dominican Republic. One with a wide mouth is recommended because they're easier to fill up. There is a filtered water fountain in the ILAC Comedor that you will use to fill up your water bottle. You want to use this water for drinking or water in the water bottles provided in your casitas by the ILAC staff. Water in the sinks at ILAC is okay for brushing your teeth, but we do not recommend drinking tap water anywhere in the Dominican Republic. Restaurants will serve bottled water or water from a purified botellón, like botellón, like the one pictured here. Ice is safe if it is a uniform shape, and hollow squares or small tubes are common, and that would all be made with purified water. There are basic guidelines to follow when eating to help keep yourself healthy while abroad. Items that are generally considered safe would be food and drinks that are served at ILAC, sealed bottled drinks, food served at a sit-down restaurant, coffee, tea, or anything boiled, food that has been fried or boiled, fruits and veggies that you can peel, and snacks in original packaging. Items that you should stay clear from are juice or drinks from street vendors if they're not sealed and not kept cold, food from street vendors that has been sitting out for a long time, uncooked street food like cheese or ice creams, food in homes that may have been sitting out overnight, or tap water or ice made from tap water. Along with safe food and water consumption, here are additional tips to help you stay healthy while abroad. First, plan for heat and humidity. If you overheat quickly, bring a personal fan or a hand fan or a cooling towel that you can use when needed. Take your vitamins, and especially if you're a picky eater. Changes in diet make it hard for some travelers to get all the nutrients they need, so a daily supplement can help keep you healthy. Maintain your regular eating, sleeping, and exercise habits as best as possible during your time in the DR. The ILAC-CISI campus has a track where you can walk on campus. Please be diligent with sunscreen and bug spray for protection. And report any illness to your program leader. If you're not feeling well, let us know. And finally, hydrate, hydrate, hydrate. That helps so much, especially as your body is adjusting to new foods and a new schedule. What happens if you get sick while in the DR? Don't worry, it may happen and it's nothing to stress over. First, we will likely recommend some R&R at the ILAC Center to let your body recover. If you do need any tests or medical treatment, we will accompany you to a private hospital like the one pictured here for treatment. Holmes Hospital, shown here, is a very modern hospital near to the ILAC-CISI campus, and we have a relationship with many English-speaking doctors and physicians at this hospital. You will always be accompanied by a member of the ILAC staff if you need to seek medical care. You will be required to pay upfront for any services needed, and you can then submit your receipts to your insurance provider for reimbursement. There may be some non-reimbursable costs, small costs such as staff parking at the hospital or meals that may not be covered or reimbursed by insurance. All Creighton University students, faculty, and staff are enrolled in CISI emergency medical insurance prior to travel. You will receive confirmation of your enrollment directly via email from CISI. This email will include your explanation of benefits, all of your coverage details, your insurance card, how to submit a reimbursement, and other important information. You will not receive a physical insurance card. Everything will be in this email, so make sure that you're looking out for it. CISI reimburses emergency medical costs while abroad, really everything that you would need to have covered, from hospital visits to prescriptions to testing, scans, things like that. But you do need to pay at your time of service. Keep all of your receipts for submission to reimburse through CISI. And CISI is a supplemental plan, so travelers should all keep their main insurance coverage during their time in the DR. For non-Creighton programs, CISI is optional, so please check with your program leader to confirm if you will be covered by CISI or a different medical plan while abroad. The safety of our program participants is top priority of the Creighton ILAC staff and ILAC-CISI staff. The over 50-year relationship between Creighton University and the DR means that we are well supported while in the Dominican Republic, but it's still each traveler's responsibility to be aware of current traveler safety recommendations. At the time of recording, the U.S. Department of State advisory for the Dominican Republic is a level 2. It isn't uncommon for the DR to fluctuate between level 1 and level 2 advisory, and it's nothing to be concerned over if it does fluctuate during your time. Creighton ILAC and CISI will monitor all travel alerts, and we will adjust any programming or scheduling as needed. Advisories or alerts are often for busy tourist zones that are not near the ILAC-CISI campus and in different areas of the Dominican Republic, but general safety rules always apply. Be aware of your surroundings, keep your valuables and phones in a secure area, don't leave things lying around or hanging out of your back pocket. And know that the ILAC Center has a gate and security guards that work 24 hours a day, 7 days a week, so the center is very secure. There is a 24/7 emergency phone number. If you have any emergencies or need support, you can see it listed here. And this number is always answered by a member of our Creighton ILAC staff in the Dominican Republic. If you have questions on any of the information here, please contact ILAC at ilac@creighton.edu.